lot of the more misconceptions about joint replacement today are based on the way we as joint surgeons used to do replacement 10, 15 years ago. Currently today we use an approach for pain so that we use spinals to try and relieve your pain during surgery and after surgery. We use blocks around the knee to try and prevent the pain from surgery. And we are very aggressive with therapy and really encouraging patients to get home because that's where you heal best and that's where you heal fastest. Old misconceptions such as, do I need to stay 3 or 4 days in the hospital? It's not true anymore. Again, the research really shows that getting home and recovering faster is the best way to get back on your feet and go back to things you love doing. The other misconceptions are about machines such as after knee replacement. Do you need that? We really don't use that a whole lot anymore because we know that just getting home, getting active, staying active will really get you back on your feet as best as possible.